Despite best efforts of many of us, Canadians are coming down with COVID time and time again.
I've been vaccinated. I've got COVID 4 times while being vaccinated.
Even our fully vaccinated Prime Minister isn't immune, attending question period virtually while he gets over his second case in 6 months.
We're looking at a probable future where if we're engaging in the kinds of social behaviors we've become used to in the last few years, pre-pandemic, we're each looking at 2, 3, 4 infections per year.
COVID reinfection depends on a couple of things, experts say, new mutations being one. Federal data is limited, but the latest information shows while Omicron's BA2 is dominant in Canada, subvariants BA4 and 5 are making gains. In the U.S., those subvariants already account for 21% of infections, and European health officials say they are spreading more rapidly than others.
If you were infected with Omicron or any of the subvariants, it doesn't mean that you're good and protected for the next few weeks or months or whatever it is that people think.
That brings us to infection immunity. There's a growing list of evidence to suggest Omicron specifically does very little to protect you from catching the virus again. And while COVID is here to stay, experts are still adamant vaccinating the youngest Canadians and boosting the most vulnerable will help, as will strain-specific shots and even new nasal vaccines.
But if you are still infected, it can help you clear that infection more quickly. And that's the important part, because if you clear the infection, you're less likely to pass it on to somebody else, which is important. And it also gives the virus less chance to replicate in you.
Diminishing COVID's ability to evolve, meaning less chance at repeat infection, the effects of which we still know very little about. Mauracher, Global News, Toronto.